Adjustment disorder is an mental health condition. Look at this picture, shows that experience anxiety, stress, depression, detail going on. Introduction. Adjustment disorder is a stress-related condition where individuals experience emotional or behavioral symptoms in response to an identifiable stressor such as significant life change or event. The disorder arises when the person's reaction is more intense than expected, impacting daily functioning. Unlike other mood disorders, AD is specifically tied to an identifiable sources of stress, with symptoms typically subsidizing once the stressor is resolved or managed. Definition. Adjustment disorder is defined as a psychological response to a specific stressor characterized by the development of emotional or behavioral symptoms that significantly interfere with social, occupational, or other important areas of functioning. It usually develops within 3 months of the onset of the stressor and can persist for up to 6 months after the stressor has been removed. Types. The DSM-5 outlines 6 types of adjustment disorders. 1. Adjustment disorder with depressed mood, sadness, hopelessness, and lack of interest. 7. Adjustment disorder with anxiety, worry, nervousness, and jitteriness. 3. Adjustment disorder with mixed anxiety and depressed mood, symptoms of both depression and anxiety. 4. Adjustment disorder with disturbance of conduct, behavioral issues like aggression or defense. 5. Adjustment disorder with mixed disturbance of emotions and conduct, a combination of emotional and behavioral symptoms. 6. Unspecified adjustment disorder, symptoms that do not fit into the above categories. Causes. Adjustment disorder typically arise from specific external stressors, which may include 1. Loss of loved one, 2. Relationship issues such as divorce, or separation, three major life changes like job loss, retirement, or moving. For financial difficulties, 5 health concern or chronic illness. Risk factors. Certain factors increase susceptibility to adjustment disorder. 1 lack of support network, 2 history of mental health conditions, 3 childhood adversity or trauma, 4 high sensitivity to stress, 5 poor coping skills. Complications. If untreated, adjustment disorder can lead to complications such as 1. Depression and anxiety disorders, 2. Substance abuse, 3. Suicidal thoughts or actions, 4. Chronic stress related health issues. Pathophysiology. Adjustment disorder involves a maladaptive response to stress, which affects the body's neuroendocrine and lymphatic systems. Prolonged stress alters cortisol levels and neurotransmitter balance, which can disrupt mood and behavioral regulations, leading to emotional and physical symptoms. The pathophysiology of adjustment disorder involves a complex response to stress, which disrupts the neurobiological symptoms in the body. Here is step by step breakdown. 1. Exposure to stressor. 2. Activation of the hypothalamic pituitary adrenal HPA axis. 3. Elevated cortisol and physiological stress response, or neurotransmitter imbalance. 5. Impact on lymphatic system. 6. Maladaptive coping and emotional regulation. 7. Physical symptoms emerge. 8. Chronic maladaptive response. If stress persists over the individual lacks coping mechanisms, the adjustment disorder may become chronic. Leading to prolonged emotional and physical symptoms. This ongoing cycle can create a feedback loop where stress perpetuates emotional and physiological disturbances, making recovery challenges. Signs and symptoms. Symptoms of adjustment disorder vary by type but may include 1. Emotional sadness, anxiety, anger, and hopelessness. 2. Behavioral, social withdrawal, aggression, defense, and increased risky behavior. 3. Physical, headache, gastrointestinal issues, fatigue, and insomnia. Diagnosis involves assessing the patient's recent life events and current symptoms. Key diagnostic criteria include 1. Symptoms must begin within 3 months of the identifiable stressor. 2. Emotional and behavioral symptoms should significantly impair daily life. 3. Symptoms should not meet the criteria for another mental disorder. Nursing diagnosis. Potential nursing diagnosis for patients with adjustment disorder include 1. Anxiety related to life changes and stresses. 2. Ineffective coping related to maladaptive response to stress. 3. Risk for self-harm due to feeling of hopelessness. 4. Social isolation related to emotional distress and withdrawal. Management. Medical management. 1. Psychotherapy, cognitive behavioral therapy, CBT, is effective in helping individuals understand and manage their response to stressors. 2. Medication. Antidepressants or anti-anxiety medications may be prescribed if symptoms are severe. Nursing management. 1. Provide emotional support. Offer a non-judgmental space for patients to express feelings. To encourage healthy coping mechanisms. Teach relaxation techniques like deep breathing and mindfulness. 3. Promote social support. Encourage patients to seek support from family, friends, or support groups. 4. Monitor for signs of self-harm. Regularly assess for any signs of suicidal ideation or self-harm. Treatment. The primary treatment for adjustment disorder includes 1. Psychotherapy. Help patients build resilience and improve their coping skills. CBT and supportive counseling are particularly beneficial. 2. Medications. Temporary use of antidepressants or anxiolytics can help manage severe symptoms. 3. Lifestyle adjustment. Regular exercise, good sleep, and healthy eating can improve mental well being. Psychosocial medicine. Here are 5 psychosocial medicine interventions that are commonly used to support patients with adjustment disorder and other stress related conditions. 1. Cognitive behavioral therapy CBT. 2. Mindfulness based stress reduction MBSR. 3. Interpersonal therapy IPT. 4. Supportive counseling. 5. Problem solving therapy PST. PST structured problem solving skills empowering individuals. Prevention. While not all cases of adjustment disorder can be prevented, strategies include 1. Building resilience. Encourage patients to develop strong coping skills and a positive outlook. 2. Promoting support networks. A strong social network can act as a buffer during stressful events. 3. Educating on coping techniques, mindfulness, stress management, and problem solving techniques can mitigate the risk of developing adjustment disorder. In conclusion, adjustment disorder is a time limited stress induced mental health condition that can significantly impact an individual's life. Prompt intervention with psychotherapy in some cases, medication can help patients control and improve their quality of life. Early diagnosis, supportive care, and coping strategies are essential in managing and overcoming adjustment disorder, ultimately fostering resilience and emotional well-being. Thank you. Have a nice day.